Welcome to New Jersey Viewpoint. I'm Ken Rosato. A new program addresses the fact that many children with vision problems are doing badly in school without anyone realizing that their eyesight is the issue. We also bring you a world champion martial arts professional who's taking on bully prevention in a new book. But first, every single day, more than 5,200 people will be diagnosed with diabetes in the United States. The majority will be type 2 diabetes. Nearly 26 million children and adults in the U.S. have diabetes, and 1 in 4 people have it, or rather who have it, are unaware that they actually do have diabetes. An alarming fact, given that prevention and early detection are the key to controlling that disease. Joining us in the studio are Dr. Mina Murthy from the Thyroid and Diabetes Center at St. Peter's University Hospital and Jillian Pryor, Development Manager for the American Diabetes Association. Welcome. Well, first of all, what are some of the symptoms that people should look out for to know that they might have diabetes?
To wait for symptoms of diabetes, it's too late.
Ah, oh, there you go. Okay, thank you for joining us. So what should we do? How should we beware and be preventive and proactive?
If 1 in 3 people are going to be developing diabetes and they're at risk, each one of us should be taking the risk assessment test, and that depends on who our parents were, what our genetics is, whether we are overweight and obese, whether we are physically active or unfit. You know, those things determine whether we are at risk. And if we are at risk, then we should do a test called hemoglobin A1C, because it may be 10 years before you know you have diabetes and you have already developed complications.
So if we have parents, grandparents, siblings who have diabetes, then the chances are greatly increased that we too may develop diabetes.
And if we are from certain ethnic backgrounds, like African Americans, Latinos, Asian Americans are at very high risk. Native Americans are very high risk.
Well, listen, I have to say that I used to be very, very obese as a younger person. I lost all my weight, but does that mean that because I was heavy at a younger point that I still have an increased risk of developing diabetes at this point? Or now that I've lost my weight, are my chances decreased?
Much decreased, but under nutrition, when people are very lean, they can have diabetes. So they're not necessarily fit just because they're underweight. So
okay.
It's being lean and fit. You can postpone diabetes.
Gotcha. Let me ask you now, Jillian, you're the development manager for the American Diabetes Association. Tell me what kinds of things, first of all, the association does to get the message out to people.
Sure. Well, first of all, the American Diabetes Association is a national nonprofit organization, and we have various local offices all throughout the United States, including here in New Jersey. And our main focus truly is prevention. As Dr. Murphy mentioned, the earlier you detect diabetes, the less serious complications that you're going to have as a result. And we have many preventative programs here in our local offices that attempt to alleviate some of those complications. We have 4 programs here in New Jersey that are geared towards helping those who are particularly at risk, such as the African American, Hispanic and Latino, and Native American, and Asian American ethnic groups. And we go into those communities and teach them about the symptoms of diabetes, the risks, how they can prevent the disease through healthy lifestyle and working out, and what they can do to manage their diabetes if they've already been diagnosed. So those are really, really key to us in lessening the great complications of the disease.
What would you say the #1 factor is? Is it really going right back to the refined white food, if you will, the white flour, the white rice, the sugar that we have over the years made such a main part of our diet in the United States?
Yeah, it is sugar, you know, sugar-containing foods, but as well as fat, because fat, per gram of fat, there are 9 calories. Mm-hmm. And fat is the root cause of diabetes in many people. Mm-hmm. So the amount of calories we consume, the amount of empty calories we consume without the micronutrients, that is our problem.
Yeah. I'm just thinking back to when I was heavy, and when I would cut out carbs, you know, a la the Atkins diet. If you were successful in cutting out carbs and you had a little bit of fat, you were fine. But once you had the carbs with the fat, you have to be rigid about it. You can't play with it. That's the thing. I would lose my weight successfully, but that was me, you know, and I'm sure you'd have to consult with your doctor and be very careful with your doctor in formulating a successful plan. The sugar spikes, I'm sure, that people experience can't be good. And how can one develop, or let me ask you, can one develop type 2 diabetes, even if they don't have the genetic factors from their parents, grandparents, etc., by having the bad diet and not exercising?
Definitely. A lot more of us are having diabetes today as opposed to our parents or grandparents because we live a different lifestyle. The human body is meant to live in a jungle, and if we are not having that lifestyle of running around, eating raw food or fresh food, we consume too many calories, we are very sedentary, and this environment is not made for the genetics we are born with.
So you mean we weren't made to sit around eating potato chips and cake all day? You mean that's not what
not
our
at
body...
all.
Oh, okay.
We are survivors and we have thrifty genes, so we have to remember it, right? We have very calorie efficient bodies.
Right. And what would you recommend to get kids started from a very early age to keep them at best odds not to develop diabetes later in life? What is the best way to get them started? What kinds of food should they be eating? What kind of lifestyle should they be living?
Move it to lose it.
Move it to lose it. So tell us about that between you and the American Diabetes Association.
Yeah, always physically active. You know, find sports and activities, things that get you out of the chair. You know, stop being addicted to the screen or the mobile phone, the computers, anything like dancing, things that people enjoy.
And just the education. We have programs that go into the schools and teach children about the right things to eat that they're still going to enjoy, and really promoting physical activity during the school day and also outside of school. So being involved in sports, dance, really anything to get them moving. And just 30 minutes a day of activity greatly lessens your chance of developing type 2 diabetes.
Dr. Murthy and Jillian Pryor, thank you both for being with us. Such important information, and it is so important to be proactive. Don't wait till you might be symptomatic, because diabetes can sneak up on you and often does.
And it is preventable.
That's the key. It is preventable. Thank you both for being here.
Thanks.
We're going to be right back with a great program that has VSP Vision Care working together with Big Brothers Big Sisters. Stay with us.